Let's talk about a very popular condiment, food, whatever you want to call it, which is chocolate. Now, chocolate, a lot of people love chocolate. It has one of the elements in chocolate, which is interesting, is something called, with the acronym of PEA. I don't remember the full name or how to pronounce it, but let me put it this way. When you are in love, when you have feelings of deep love, this stuff called PEA rises in your brain, and it's considered kind of like a natural amphetamine. This is the reason why a lot of people crave chocolate. But there are when you're talking about chocolate, you have to be specific. The chocolate itself, the typical, let's say, chocolate bar or that type of thing, it's just loaded with sugar. It has really no nutritional value. It's basically junk. I remember when I was a kid, I remember going to a summer camp when I was about 10, 11 years old, and I was introduced to a type of chocolate called white chocolate, which it's as the name implies, it was white, but it had a kind of a chocolate taste. It tasted like a combination of chocolate mixed with vanilla. It was incredibly, almost addicting. I mean, I loved it. Little did I know I was eating just chunks of pure sugar. It's junk. So you have to separate chocolate from the really healthy stuff, which is cocoa. Cocoa powder, dark chocolate. Dark chocolate contains elements called polyphenols, which are antioxidants that provide a number of important health benefits. But cocoa has been used for many years. It was actually favored by the ancient Mayan civilization of Central America. The Spanish conquerors noticed that the Mayans were eating a lot of cocoa, and they brought it back to Europe. And in the 16th century, it became was considered like a health medicine. The cocoa powder is produced by crushing cocoa beans and removing the fat, or cocoa butter as it's called. A lot of times you see cocoa butter show up in skin creams and in shampoos also. But let's talk about some of the health benefits of cocoa, not chocolate, cocoa. And again, if you want to eat a natural form of cocoa, something like 85% dark chocolate is rich in some of these cocoa compounds that I'm about to discuss. But typical chocolate bars contain nothing. They're just pure sugary garbage. As I mentioned, one of the most important elements found in cocoa are polyphenols. These are natural antioxidants similar to other compounds that are found in fruits, vegetables, tea, and wine. There's been numerous benefits attributed to these polyphenols: reduce overall inflammation, better blood flow, lower blood pressure, and improve blood lipids such as cholesterol, and also better control of blood glucose levels, which helps to prevent diabetes. There's about 50% of at least 50% of Americans walking around have what they call insulin insensitivity, which is basically considered pre-diabetes. It's a precursor to type 2 diabetes. I have it myself, so I mean, I'm not an exception to the rule. I have it because of certain genetic components. Diabetes type 2 was very prevalent in my family. My father, both my grandfathers had it. And blood glucose problems in myself didn't show up till I hit about 55 years of age. Before that, I had zero problems with blood glucose. But ever since then, my blood glucose has been harder and harder to control. I take one medication called metformin. Of course, I exercise. I don't want to get into my personal problems, but I just wanted to mention that cocoa could possibly help with insulin insensitivity. One of the things that's interesting about cocoa that a lot of bodybuilders might be interested in is that cocoa is very potent at raising nitric oxide levels. Nitric oxide is a type of gas that's produced in the various parts of the body through the conversion of the amino acid arginine. It can also be produced by ingesting citrulline, which is converted to arginine in the kidneys. Nitric oxide has a number of numerous benefits, but one of the main things it does is it dilates blood vessels. It widens blood vessels, and by doing that, it reduces high blood pressure. Well, it turns out that cocoa actually very potently raises nitric oxide levels. About 2 hours after you consume cocoa, your nitric oxide blood levels will rise considerably. This is probably related to the polyphenol content of cocoa, because nitric oxide, once it's produced in the blood, it's rapidly degraded, it's rapidly oxidized. In other words, it's oxidized, and once it's oxidized, it has no activity. In fact, it actually can turn into what they call a pro-oxidant called peroxynitrate, which is harmful to health. And the polyphenols in cocoa are very efficient at protecting nitric oxide, and by doing so, it raises nitric oxide levels, and it also reduces blood pressure. There was one review that analyzed 35 clinical trials that provided the study subjects with 0.5 to 3.7 ounces of cocoa, or roughly 30 to 1,218 milligrams of cocoa flavonols. It found that cocoa produced a small but significant reduction of 2 milligrams of mercury in other words, 2 millimeter drop in blood pressure. The effect was much greater in people who already had high blood pressure, and it was slightly greater in younger people compared to older people. Now, cocoa, again, probably because of its effect on nitric oxide and lowering blood pressure, it also will help to prevent heart attacks and strokes. Besides raising nitric oxide, the cocoa polyphenols reduce what they call the bad cholesterol, which is low-density lipoprotein. Low-density lipoprotein, when it's oxidized, it tends to stimulate atherosclerosis, which is basically a narrowing the arteries. Calcium builds up, you get a narrowing of the arteries, which greatly increases the chance of cardiovascular disease. Cocoa also has a blood thinning effect, not unlike aspirin without the side effects, and that prevents the formation of an internal blood clot, which when combined with atherosclerosis can block an artery, let's say a coronary artery, and cause a heart attack, or in the brain it can cause what they call an ischemic stroke. Cocoa also decreases insulin resistance. As I said, insulin resistance also, having insulin resistance increases your risk of cardiovascular disease 12 times over baseline, and it reduces systemic inflammation, which is also, inflammation is considered a primary underlying cause of cardiovascular disease. So, put it all together, some studies have shown that ingesting cocoa leads to a lower risk of heart attacks, heart failure, and stroke. One review of 9 studies that covered 157,809 people found that higher chocolate consumption, that's dark chocolate, was associated with significantly lower risk of heart disease, stroke, and death. 2 Swedish studies found that chocolate, again, dark chocolate intake, is linked to a lower rate of heart failure at a dose of 1 serving or 19 to 30 grams of chocolate per day, but eating any more than that didn't increase the benefits. Also, the increase of blood flow promoted by the polyphenols in cocoa also increased blood flow to your brain. Now, this is very important because a lack of blood flow to the brain is a primary cause of the death of neurons or brain cells that leads to neurodegenerative diseases such as Alzheimer's and Parkinson's disease. The flavonols in cocoa, flavonols are, those are the specific compounds or polyphenols that are found in cocoa. They can cross the protective blood-brain barrier, and by doing so, it actually increase the local production of nitric oxide in the brain, which increases the blood flow and blood supply to your brain, increases oxygen delivery. One 2-week study of 34 older adults given high flavanol cocoa found that blood flow to the brain increased by 8% after 1 week and 10% after 2 weeks. This other studies show that cocoa flavonols help retain memory as you age. Some studies suggest that ingesting cocoa, one of the main polyphenols, by the way, is called epicatechin, and ingesting this stuff actually helps to retain your memory functions, protects the hippocampus area of the brain, where the main site of memory and learning and intelligence. And also it can help prevent the so-called senior moments, where you let's say you forget your key, or you can't remember the title of a book or a movie that you just saw 2 hours ago. Cocoa, by increasing the blood circulation in the brain, can help prevent some of that. It also, some indications, speaking of the brain, there's some studies indicating that ingesting cocoa improves mood, and it can decrease depression. The cocoa flavonoids help to increase the conversion of the amino acid tryptophan into serotonin, which is a brain neurotransmitter. Low levels of serotonin in the brain are associated with increased depression. Many of your antidepressant drugs work by increasing serotonin content in the brain. The little bit of caffeine that's found naturally in cocoa also helps to improve mood and decrease depression. There was a study in older men that showed that a preference towards eating chocolate was linked to better overall health and better psychological well-being. As I said earlier, because of its effects on insulin sensitivity, cocoa flavonols or polyphenols can help prevent diabetes. Isolated or test tube studies show that cocoa flavonols can slow down the digestion of carbohydrates and reduce their absorption in the gut, which in turn improves insulin secretion, reduces inflammation, and stimulates the uptake of sugar from the blood into the muscle. Some studies have shown that a higher intake of flavonols can lower the risk of type 2 diabetes. And again, studies show that cocoa can increase insulin sensitivity and blood sugar control. It also can help weight control, because cocoa helps to regulate the use of energy. It helps to reduce appetite, and it might actually help increase fat oxidation when you exercise. One study showed a link between people who consume dark chocolate more frequently and a lower body mass index, despite the finding that eating chocolate was often linked to eating more calories and fat. A weight loss study that involved low carbohydrate diets found that a group given 42 grams, or about 1.5 ounces of 81% cocoa chocolate, lost weight faster than the regular diet group, meaning the group that followed a low-carb diet but did not eat chocolate. In other words, chocolate increased the amount of weight lost above and beyond just eating a low-carbohydrate diet alone. The elements or polyphenols in cocoa, again, isolated studies have shown that the antioxidant effects protect cells from damage from what the byproducts of oxygen called free radicals, which are involved in causing DNA mutation and cancer. So cocoa might also have some cancer protective effects. Animal studies show that providing the animals with cocoa extracts seems to reduce various types of cancer, including breast, pancreatic, prostate, liver, and colon cancer, as well as leukemia. So these are animal studies. There is some human studies that suggest that ingesting cocoa can also help prevent cancer in humans. There are other elements besides the polyphenols and flavonols in cocoa can help with various things, such as there's an element in cocoa called theobromine. Theobromine is basically helps reduce coughing. It helps you breathe. It provides a little bit of energy. Theobromine, by the way, is extremely toxic to dogs. So if you ever keep cocoa powder or something like that around, make sure that your dogs don't have access to it. Make sure none of it spills on the floor, because theobromine could kill dogs. Besides theobromine, you'll see theobromine sometimes added to pre-workout supplements because of its supposed energy-producing effects. It's kind of similar to caffeine in some ways. A cocoa powder contains 1.9 grams of theobromine per 3.7 ounces. Cocoa also contains an element called theophylline. Theophylline dilates the lungs. It helps the airways relax. Well, I've had asthma since I was 12 years old, and for many years the primary drug that I used to control my asthma was theophylline. I took it twice a day, and it turns out that when you're on a high-protein diet, your liver actually metabolizes theophylline twice as fast as normal. So the theophylline would often wear off after only about 4 hours. It's supposed to last 6 to 12 hours, but my high-protein diet caused me to metabolize theophylline a lot faster. You very rarely see theophylline given out for asthma these days because theophylline unfortunately had some overlapping cardiovascular stimulation effects, tended to speed up the heart a little bit, and they came out with more other drugs over the years which were more specific, such as beta-2 agonists. Clenbuterol, the drug, by the way, used by bodybuilders, is a beta-2 agonist. You actually was eventually developed to treat asthma. These drugs are more specific in dilating the lungs without overly stimulating the heart. However, I remember reading, I wrote this years ago, if you have asthma and you don't have your asthmatics have to carry around a inhaler that contains a form of adrenaline. When they breathe it in, if they're having an asthma attack, it'll dilate the lungs, prevent them from dying. They call it a rescue inhaler. I carry it with me everywhere I go. I very rarely need to use it, but it's good to have in case I suddenly get an asthma attack for some reason. But the thing about that is that if for some reason you're an asthmatic and you don't have your inhaler with you, and you're noticing that your lungs feel like they're tightening up, like you're wheezing, if you drink a couple of cups of coffee contains natural theophylline also. It might actually help to relieve the asthma to the extent that you'll be okay until you can get your inhaler or get whatever treatment you need to relieve the asthma attack. So it's not that hard to get dark chocolate and your cocoa powder. 10 grams contains at least 200 milligrams of flavonols, which is a good amount, but it's not really enough to provide health benefits. For that, you have to get over 800 milligrams. They do have actual cocoa supplements. There's the Mars company, which makes famous for making chocolate bars and all that. They actually sell a supplement. I think it's called Cocoa Vita. I can't remember the exact name. It's basically concentrated cocoa polyphenols, very concentrated. This would be good for somebody who doesn't want to eat dark chocolate. Dark chocolate has a kind of a bitter taste. A lot of people, it's what they call an acquired taste. A lot of people, including myself, don't really care for the taste of dark chocolate. So if you don't want to eat dark chocolate, you can buy one of these, these cocoa. The best one, again, is called, I think it's called Cocoa Vita. It's, again, made by the Mars company. They sell it online. It's a little on the expensive side. But the thing is, it does have very concentrated cocoa polyphenols, equivalent to about 4 or 5 ounces of chocolate. Has no sugar. All it is pure polyphenols. But again, you can get it from food too. So I think that really covers it for cocoa. I think it's fantastic stuff. But again, always remember that it's cocoa, dark chocolate, or raw cocoa powder, that type of thing. Those are the things that provide health benefits. Regular chocolate is junk. It has no health benefits. It's just candy. I know it tastes good. I know a lot of people love chocolate, but it's not a health food. The health food is cocoa. So I'll leave it at that. If you want to have more information on nutrition, exercise, science, anti-aging research you can use today, effective fat loss techniques that really work, supplement science, which supplements work, which ones don't. I'm not aligned or associated with any supplement company, so I will tell you the 100% truth. I'm not a shill like about 90% of the people that make YouTube videos. You'll see if they mention a supplement or if it's in the in their information box under the video. You can be assured that they're associated with a supplement company. They're getting paid off to push certain supplements. I am not. I am not associated with any, so I can tell you the full truth about supplements, women's health and fitness, ergogenic aids, hormonal therapy. All of that is covered in my Applied Metabolics, www.appliedmetabolics.com. It's 30 to 45 pages every month, pure information written in magazine style. It's evidence-based. It contains evidence-based information. It's very readable by anybody who has about a 6th grade education. And even if you don't want to read it, you can use one of the Microsoft Read programs, which will read the whole article for you. You don't even have to be able to read to get benefit from Applied Metabolics. So again, subscribe today. When you subscribe, send me an email. I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, and general medicine and health. I do have an email portal on my Applied Metabolics webpage, but that is exclusively for current subscribers of Applied Metabolics who could send me short questions about anything they might have read in Applied Metabolics or anything related to nutrition or exercise that comes to mind, and I will answer their questions as an appreciation of their subscription to Applied Metabolics. And I will also add that while there are other digital publications, some of them are pretty good. I admit some of the information is pretty good. None of the people that publish these other digital publications have a background in professional writing like I do, which is 45 years and about 9,000 articles published. So they really don't know how to write, so it's a little bit harder to understand their articles. They tend to slip into technical jargon and that kind of stuff. My articles are very easy to read, very easy to assimilate and understand. So again, if you subscribe, I guarantee you will learn something with every issue. I don't care what your level of education is. So that's about it. Geez, I tell you guys, I know in my last couple of videos I mentioned, Bruno, my dog, my little dog of 20 years I had him. He was 23 years old, passed away on March 12th. And I always end these videos by saying, if you want to have the best friend you'll ever have, go to a local shelter and adopt a dog. And, I know that's true, but I never realized really fully how true it was until my little buddy Bruno wasn't here anymore. I mean, I kind of you kind of take it for granted having this little fellow around you all the time, but I never realized how much benefit it was to have him within proximity of me, where I could walk with him and hang out with him a little bit. And I really miss him really bad. And I am going to get a dog. Probably by the time of my next video, I'll have a dog. I'll introduce him in one of my videos. But take it from me, there's no animal in the world. Cats are great too, don't get me wrong. But there's no animal I could think of that provides the loyalty and love that a dog does. So if that's what you want, go adopt a dog. You will not be sorry. Trust me. And also, and I'll give you a little tip. If you want to have the most loyal and loving dogs, don't go for the puppies. Go for the middle-aged to older dogs. Older dogs, somehow, most of my dogs have been older dogs, except for Bruno. I got him when he was 3. But I mean, they seem to appreciate. They know that you've saved their life and adopted them. And they are so loving and loyal that it's amazing to see. Take care. Thank you for listening.